Now, yesterday, the first confirmed case of Ebola in the United States was found in Texas, of all places. Now, the patient reportedly came from Liberia, which has been heavily hit by this virus. He came here to visit family. Now, NBC News reports that this patient right now is currently in critical condition in a Dallas hospital. Totally understandable. He's got Ebola. Now, they're not sure how this man became infected. As far as health officials are reporting that he wasn't a health worker, so he must have gotten infected somehow through contact with someone in Liberia that had it. Now, health workers, of course, have the highest chance of being infected with Ebola. Health workers, as well as missionaries in Liberia, in some of these countries in Africa, get a really high chance because they have more contact with people. Now, we're missing some important information, but what some people are worried about is some of the people who are on the flight with this gentleman. Now, thankfully, Ebola doesn't spread through the air. It's not airborne, right? It's spread only with contact with bodily fluids, blood, vomit, diarrhea, etc., right? And the patient is only infectious when sickness is present, so even if you have it and you're not presenting symptoms, you are not infectious. All right. So that's good. And that also means that people on the flight are really, really unlikely to have contracted Ebola as well. His flight from Liberia was about September 20th. Now, he didn't report being ill until like the 24th. Still, nonetheless, other passengers on that flight and anybody who's had contact with him are being watched for symptoms, which is smart. That's the smart thing to do. They've got about 21 days to watch for symptoms until they're in the clear, because the longest case of incubation with Ebola has been 21 days. So it doesn't really hurt to be cautious, even though, according to CDC Director Dr. Thomas Frieden, there's pretty much no chance he could have infected anybody on that flight, because they would have checked for fever before leaving Liberia, as well as checking for fever afterwards when they arrived in the United States. So we've got this rigorous checking program that, is really searching for this. We know that it's a problem area in Liberia, and our officials are saying, okay, we need to set up preventative measures, and they've done so. So to the people who are worried about an outbreak here in America, I'm here to tell you that it's pretty unlikely. Not just because the CDC says so, but because of some of the facts about the disease itself. Once again, it's spread only through close contact with an infected person's bodily fluids. And let's be honest, when people get sick here in America, they don't hide it. Now, in Liberia, they do. In some of these African countries, a lot of people do hide this sickness. It's sort of taboo in a way. So, no, I'm fine. Then a family member will find them later, they'll handle the body, and then they'll get infected with Ebola as well. That's why it's spreading. That's one of the reasons it's spreading so fast. Now, Ebola also doesn't persist on surfaces like the flu. Dies pretty quickly when it's outside of a host. Also, we don't have the same issue here in America with dead bodies piling in the streets. They get left overnight because there's just nowhere to put them. And speaking of burial customs, where to put them, in America we don't have burial customs in which people touch the body of the deceased in order to help the grieving process. We don't really do that here like they do as much in these other countries. Sierra Leone, Liberia, a couple of cases in a different outbreak in Congo, etc. Those countries that are being hit really hard by Ebola right now. So there are a lot of reasons why Ebola is spreading in those places. But those reasons, they don't really exist here. For example, there's some economic factors involved. There's civil wars going on in those places. You have a definite lack of health infrastructure, and that's really important. You don't have a lot of hospitals, a lot of medical personnel, not as much as we have in America. You also have those local customs, as I mentioned, lack of medical knowledge. A lot of people haven't even heard of Ebola. They don't know what it is in those countries that are being ravaged by it. So, I mean, you just have a lot of ignorance there. Not willful, but just a lot of ignorance about what happens there, what this disease really is. And that's one of the main problems, is that they don't know what it is, they don't know how to prevent it, they don't know how to treat it. Where in America, we've been aware of Ebola for decades, at least. And then another one of the final things that make it a real problem in these African countries that doesn't really exist as much here is a huge, deep-seated mistrust of medical personnel, especially medical personnel from other countries. When you look at some of these factors, realize the chances of Ebola happening here in America, like it's been happening in Liberia, Sierra Leone, and the other countries, you realize that the chances of it happening like that here in America are very, very low. Seems very unlikely because of the facts of the disease itself. It can be prevented through good hygiene, hand washing with soap and water, using disinfectants. The truth is that Americans have so many advantages when it comes to stopping this particular disease from taking hold, from taking root. So really, I think when you present yourself with the facts and you read up on it and you avoid the scare tactics from the media, because the whole reason that the media is beating the "oh my God, Ebola" drum is that it's really good clickbait. People love to... we have a scare tactic media, and they make a lot of money and a lot of clicks off scaring the shit out of people. And this is one of those things. But when you really look up on the facts, you realize that it's not as much of a clear and present danger to Americans as the media makes it seem. Now, it's a clear and present danger for Africans. And it's expected to get worse there, but not here. I think as far as America is concerned, I think we should be cautious, definitely cautious, and do preventative measures. But I think also, we as Americans, we kind of need to calm down and realize that we're not going to have an Ebola epidemic.